The epicenter of COVID-19 in the country, Gauteng accounts for 69% of all active cases. In the latest numbers from the National Institute for Communicable Diseases, NICD, the province recorded just over 6,000 cases. Last night's figures also reveal a positivity rate of 24.9%. This means for every 4 people that are tested, 1 tests positive. Let's unpack these numbers then. I'm joined via Skype by Professor Adrian Puren from the National Institute for Communicable Diseases. A positivity rate of 24.9%. Prof, that's really cause for worry, especially if you live in Gauteng.
Of course, yes, that's right. As you said, it's 1 in 4 people who are presenting and tested positive, but you can just imagine that there are probably larger numbers than that. In fact, as you know, WHO recommends that you need to really expand your testing above 5% to really get a sense of what's actually happening. So we're doing testing, perhaps not to the extent that we should be doing testing, and I'm sure Gauteng, Department of Health is certainly working on trying to make sure that tests are accessible to large numbers of people to really get a sense of what's happening. But regardless of that, those numbers are certainly increasing quite dramatically. And that has obviously implications in terms of how we manage the epidemic with regard to, people who then present with serious illness and what is our hospital capacity, our oxygen capacity to manage all of this. So it's really key steps that are under consideration, I'm sure, by the Department of Health.
You're saying we're doing testing probably not to the extent that we should be doing it. Why is that?
Well, I think we have certainly the capacity, but I think it's also demand creation and knowing that, in fact, tests are available. So if there are probably people out there who probably have symptoms but are not going forward for testing. There are people who are asymptomatic who also, obviously, for those very reasons, are not going for testing. But also it's important for the Department of Health to make sure that people are aware that testing is available and where those tests are available in order for them for those individuals to be tested.
So would you say then that as worrying as the picture we are seeing in Gauteng, where we're talking about 69% of all the active cases in the country being in the province of Gauteng, as worrying as that is, it's certainly not the full picture. The picture is probably worse than what we are seeing.
Yes, so in other words, yes. In other words, if you were to look at the context of the numbers of cases, you can certainly multiply that up. But also there are obviously concerns now with other provinces that have continuing transmission, such as the Northern Cape, Orange Free, and the Free State, for example. But also we are certainly seeing now an increase, at least in the Western Cape as well, that is certainly showing a dramatic increase as well in the case numbers. It's not to the same extent as Gauteng, but these are opportunities for provinces such as the Western Cape, Eastern Cape, KwaZulu-Natal, to really make sure that their resurgence plans are in place in order for them to either stave off the numbers, and that's really very important, and or to be able to manage were the numbers to increase to the extent that was seen in the previous resurgence. So it comes back to the risk communication, because this is about contact. In other words, people are in contact with each other for transmission to occur. It's really around this risk communication around the wearing of masks, wearing them correctly, the physical distancing, the actual hand hygiene. If you don't have to be at work and can work from home, then that's great. Unfortunately, there are large numbers of people who, for good reason, have to go into work and be at work. It's again ensuring that there are safe health practices at work to ensure that we minimize transmission. So it's contact. And social bubbles. Again, if you do not have to be in social contexts, avoid those. The larger numbers of people, avoid those. All those risk behaviors that we think we can get away with, we should try and reduce and minimize that as best as possible.
If that is not happening voluntarily, Prof. Puran, people creating the social bubbles and breaking off the contact, which is transporting the virus in our society, are we at a point where, at least in Gauteng, at the very least in Gauteng, that should be enforced by more stringent restrictions?
Yeah, so I think for me at least, I think engagement with community is your first objective. Have we engaged sufficiently to make sure that our communities are aware and understand what are the challenges that they face with regard to, for example, isolation or self-isolation, keeping distances and working on that? But I agree with you that perhaps there are contexts where, for example, enforcement may well be the order of the day. If, for example, people are aware of what the rules are but are not applying them appropriately.
And just put some narrative and a story to the graph that we are seeing in as far as the third wave is concerned, Prof. The second wave, I think the worst day at the peak of the second wave that we had was on the 9th of January, where we recorded 21,606 new cases. That was on the 9th of January. At this particular point in the third wave, the numbers that we have seen, as we see on the screen there, on the 19th of June, 13,575 new cases. That was on the 19th of June. Are you settled in your mind whether the third wave is likely to be worse than the second wave in terms of the spread of the virus, but also in terms of its impact on issues such as hospitalizations and even fatalities?
Yes, so we initially had, as NICD and part of the modelling consortium for COVID-19, had painted various scenarios for South Africa, and it's predicated, as I said, on those implementation of the non-pharmaceutical interventions and various other parameters. And in fact, overall, the view was, and may still well be, that in South Africa overall, the third wave or resurgence should not be as bad as the actual second wave. The exception was Gauteng, and I think that in a way has actually been borne out. When you look at, for example, the other provinces to date, that scenario of not having a worse resurgence is certainly the case, except for Gauteng. So I think it's a matter, therefore, of saying, well, we really need to ensure that we stave off as much and in as many cases in order for us not to be overwhelmed. But if we do not do that, in fact, if we do not have this engagement and reinforcement of the regulations, then we can certainly expect a worse wave than we've seen in the second wave. And that has severe implications for our hospital system in terms of our bed capacity and oxygen supply. I think one of the sort of glimmers of hope, at least from my perspective, is the fact that we have actually vaccinated a fair proportion of the healthcare workers. So I'm hoping that that has contributed. We haven't seen the figures in terms of breakthrough infections, but hopefully that has contributed to ensuring that at least that particular vulnerable group are secure and safe in terms of carrying out and managing the third wave.
All right, thank you for your insights there. That's Professor Adrian Puren from the NICD, the National Institute for Communicable Diseases.